Update you on some of the trend lines. I wanted to acknowledge some of the headlines, and I wanted to give you a sense of where we believe we are going as a state. I say all of this mindful that the last few weeks have been challenging. The last few weeks have changed in many respects the focus of this nation, not just this state. But I want you to know and be assured that our focus remains very direct at addressing the issue of the spread of COVID-19 and cognizant of the fact that we are by no stretch of the imagination out of the woods, and we continue to have a lot of work to do. I want to just begin with the following slide you see up here. It's a photo of the state of California. That state slide represents the equivalent of roughly 21 different states in terms of total population. It's important to make this point. The state of California, the largest state in our nation, 40 million residents strong, represents the population of 21 states. So just imagine looking at that state map, putting in over 40% of America's states. And that gives you a sense of the magnitude of the state of California and the magnitude of our responsibility to approach our response in a way that addresses the needs of different parts of the state of California, different regions. Accordingly, we have long talked about the fact that our approach to addressing the issues of COVID-19, its spread, and our suppression and prevention strategies have to be from the frame bottom up. We've long talked about the fact that localism ultimately is determinative, that we recognize local conditions are distinct and unique from one another. And we recognize that conditions in far reaches of California and northern parts of the state are very different than in the San Francisco Bay Area, very different than the Los Angeles region. And accordingly, we have afforded the ability for local health directors working collaboratively with their hospital systems, working collaboratively with advocates, and working, of course, very collaboratively with their elected officials to make determinations for themselves on when to move forward through our phased-in approach. As many of you have heard me say in the past, we put up guidelines, but guidelines don't mean go. We put up guidelines that create a framework of how we believe we can reopen the economy safely, but we don't prescribe when. We maintain, because of the size, scope, and scale of the state of California, that those decisions should be made with local lens. Those decisions should be made by allowing and advancing localism to be the thrust and the guide to ultimately making the determination of when to move forward through these phases in safely reopening the economy throughout the state of California. We've often talked about it in terms of not being an on and off switch. So it relates to when we, quote unquote, reopen, but a dimmer switch based upon, again, data, based upon science. Again, counties ultimately using data to inform their decision. And it's that data that we monitor. Accordingly, and we'll get to that in a moment, the foundational data that has described California's approach to this pandemic and the realities and the challenges that we faced in this state, in many ways can be exampled, and it certainly is exampled here and highlighted in this slide. We were the first state in the country to move forward with a statewide stay-at-home order. Its purpose was self-evident. We wanted to avoid a major spike in COVID cases, and we wanted to buy time to build out our capacity, both our physical assets, our human capacity, and make sure that we were preparing for inevitably reopening the economy. We never made the case that the stay-at-home order was a permanent state. We wanted to buy time, we wanted to mitigate a peak and a spike, and we ultimately wanted to save lives and prepare for a pandemic that needs to take its course until ultimately we have immunity, until we have a vaccine. There are a number of other states that experienced a spike, and as a consequence of experiencing a spike, they are experiencing a decline off those peaks. In California, we were able to mitigate that spike extend that curve, as we often described, and bought us the time that we needed to develop the resources so that we can effectively manage our way through this pandemic. Accordingly, we have focused on the foundational responsibility of testing so we can get a better sense of what's happening in the community, understanding the prevalence of this disease and the spread of this disease. What you could see on this slide is a significant decline in the positivity rate. Those that have been tested and the percentage of those tested that have tested positive for COVID-19 since we began testing here in the state of California in early April. Remarkably, if you look back the first 14 days in April, you'll see a positivity rate that averaged in those 14 days 40.8%. Now, of course, and not surprisingly, in the early parts of this pandemic, people with symptoms were prioritized for testing, and unsurprisingly, the positivity numbers were very, very high. But you see from the blue part of this chart that the tests were also scant. They were modest. We made that point abundantly clear, that we needed to substantially and significantly increase the number of daily tests in the state of California. You can see from this chart that we very effectively have done that. And as we've increased the total number of tests from less than 2,000 a day to, as an example, the last 2 days, 78,000 tests on Saturday, some 66,000 tests on Sunday, that the overall rate of positives have gone up, but the positivity rate, the percentage of those tested that actually have been tested positive for COVID-19 has declined and has flattened to roughly 4.5%. I say roughly because on any given day, that number, that trend of 7 to 14 days, the 4.5 reflects a 14-day average. It fluctuates, but it's fluctuated within a very stable band, particularly over the last 14 days. Again, 4.5%. A few weeks ago, I would have said it was roughly about that as well. Just to give you an indication, we use a band. You see the 14-day band here of 4.5%. We also use a 7-day figure. And 7 days gives you a more contemporary sense of, all right, we had a lot of protests a few weeks ago. Are we starting to see some positivity rate increases? The reality is, even on the 7-day band, it's roughly 4.5, 4.6% to be exact. So again, testing's increased. You see total number of positives increase as a consequence, but the percentage, the positivity rate, has declined sharply and has remained stable over the course of the last month and a half plus, and certainly reflected in that 4.5% in the last 14 days. Another thing we focus on with acuity is the spread rate. You could see, and this is, you had heard in the past, this R rate, this R naught rate. Now we have a different variant on that, but spread rate's an easier way of describing it, and it remains as well stable. It's a little higher for everyone that had COVID based upon our testing, based upon our capacity to trace. People that were infected were spreading the virus at a modestly higher rate than you see in the last number of weeks. Again, stability as it relates to spread rate. It's just an important function, again, of the kinds of examples of what we focus on day in and day out from an epidemiological perspective as it relates to the issues of the spread of this virus. So again, important graph, an important point of emphasis as we move to reopen the state around the kinds of things that we're looking at day in and day out. Accordingly, we look at hospitalization rates, and they remain stable. ICU rates, the blue line you see below the hospitalization, remain stable. What I mean by stability is over a 14-day period. Just to give a proof point, ICU numbers are flat. And when I say flat, I mean quite literally over a 14-day period have increased by 0.0%. They haven't increased at all over a 14-day period. In fact, yesterday they decreased by 2.1%, the day before by roughly 3%. So a trend line over a 14-day period that is holding stable. And you can see from that blue line, this extends well beyond just that 14-day period. It also extends through two important dates. You see on the slide, May 8th. That's when we began to modify in a significant way our stay-at-home order in the state of California. There was some sense that the hospitalization numbers would begin to increase, certainly anticipated positivity numbers to increase as we saw more mixing, more people that were out and about as we reopened the economy. But the good news is the ICU numbers remain fairly stable. The second number is Memorial Day. A lot of folks were out and about on Memorial Day, and you can see, again, the trend line remains remarkably stable. Again, our eyes are wide open. All of this data is a moment in time, though extended with the benefit of hindsight. You can see the trends, but by no means does the past equal the future. And I'm going to get to that in just a moment. Accordingly, let me go back to the hospitalization number, the orange line you see above. Hospitalization numbers went up 0.4% yesterday. They were down about 3.1% the day before, but they've remained fairly stable in the last 14 days as well. In fact, the stability we have seen in the last 14 days is about a 4.4% increase. It's an increase nonetheless. Again, no increase in ICUs, an increase of 4.4% in hospitalizations. But again, considering we worked through the stage 2, May 8th opening and Memorial Day, those numbers are encouraging, though nonetheless we want to see these numbers decline. And again, I'll get to that in a moment as well. Here's the point about capacity building I was making a moment ago that cannot be reinforced enough. We talked about our need to build surge capacity in our hospital system. We've worked hard over the last number of months to do just that. You can see specifically in this graph, over 52,000, close to 53,000 surge beds we have now identified in our healthcare system. Currently, we have 3,103 COVID positive patients. So you're looking at less than 6% of just our surge bed capacity. That does not include total number of hospital beds, that number you see above of roughly 74,000 beds. But just our surge bed capacity has been identified based upon the current census of 3,103 COVID positive patients. Less than 6% of that surge capacity has been accessed. So this is an important point about our capacity. If the numbers go up, hospitalizations go up, the question is, can we absorb that? And the answer today, at least, is yes. Again, based upon the work that we've done over the last number of months to prepare to reopen our economy and prepare for the likelihood that we will see an increase in not only number of positive cases, but also the prospect of increase in hospitalizations. Accordingly, on ICU capacity, we've worked hard to identify our ICU capacity space. There's close to 11,000 staffed ICU beds in the state of California, but roughly 3,775, I say roughly, that's a snapshot as of last night. Today, plus or minus, those numbers will change. But you get a sense that we have capacity in our ICU system to address the needs of COVID positive patients, which currently is 1,053. So less than 28% of our capacity is being utilized in ICU beds currently for COVID-19 positives. The good news is, again, we have seen no increase in the last 2 weeks in ICU cases. But nonetheless, this is a slide that represents what I do on a daily basis every morning, and that's the data that we collect that is provided to me. That is the first thing I do when I open my eyes. What's the number of positives? What's the positivity rate? What's our hospitalization capacity? What's our ICU capacity? I wanted to make sure that you have the benefit of that information that is shared with me on a daily basis. The other information that's incredibly important to note on this slide is the 11,652 ventilators that we have. That's ventilators that exist within the hospital system and ventilators that exist in our own cache. You recall, we sent to 4 states our ventilators during the acuity of this crisis. Those have been returned in most cases, and those are part of our cache in addition to the hospital system. The good news is hospitals didn't just sit back in the last few months. They've been working to get more ventilators. We continue to refurbish and work to get more ventilators. But again, having more than 11,000 vents is, from our perspective, fairly healthy at this moment, and we'll continue to work hard to increase those numbers as well. So that's an overview of where we are in the aggregate. We have a state that is holding strong in terms of stability in case rates. We didn't experience the great spikes as a number of East Coast states did. And so as a consequence, we're not experiencing a precipitous decline in the number of positive cases, but the stability remains and is holding strong. Positivity rates, ICU, hospitalizations. But we recognize those numbers are in the aggregate, and none of us live in the aggregate. If California has many parts, one body, then we have to recognize those many parts. Again, localism, notion of regions, and these attestations that they can meet certain needs, demands, and expectations. We have now 52 of our 58 counties that have put out self-attestations. Basically, they're planning to specifically address the needs of their counties as they reopen their economies at their own pace, based upon local conditions. We actively monitor all 58 counties and their current data, and we target our engagement in areas where we see the numbers that are raising a little bit of concern. And currently we have 13 counties of the 58 in the state of California where we have targeted engagement, where we are providing technical assistance, we are providing resources, human resources and physical resources. Dr. Galley is going to come up in just one moment and talk more specifically about that, and also give you a preview of the dashboard that he looks at every single day as it relates to where these counties are in terms of our targeted support and targeted engagement, and the criteria, again, that we laid out in terms of that attestation process, and give you a sense of the seriousness of focus and the acuity of focus on different parts of California as we begin, or rather as we continue to reopen this economy. So with that, Dr. Galley will go for the next few slides, and I'll come back and sum a number of the points up.